Now let's talk about digital health supply innovation, and reports indicate that South Africa, Nigeria, Kenya, and Egypt they account for about 60% of all health supply chain innovators are headquartered in Africa, with nearly 350 innovators identified across the continent. I'm glad Nigeria is mentioned there, but I mean the question is, and so what? What has it done to the economy in a country like Nigeria? We have our Director of Supply Chain and Salient Advisory, Mr. Dijoguye, right here in the studio. Mr. Guye, good morning. Welcome to the program.
Good morning, Amy. It's so good to be here with you.
Good to have you. So the numbers are good. Nigeria is part of those controlling 60%.
Yeah.
But then what's the impact?
Well, we can't, there's no available data per se just to see the economic impact. But what we've seen so far, especially in the ecosystems of these countries, first of all, the fact that those innovators are based on the continent are actually building these solutions for the African context. We can't apply the same context across different geographic locations across the world, but because they are based here, they build for that context. What we are seeing right now is a 30% reduction in the cost of distribution across some of these markets on average because of the innovations that are coming in. And we're actually seeing a significant impact on the impact of counterfeits, which actually cost a lot of
so the innovations are dealing with counterfeits.
Exactly. We have mobile tech serialization technologies. We have track and trace technologies that are actually dealing with the counterfeits, because counterfeits, they fill the pipeline, and this accounts for significant losses for the players in the market, not to talk about impacts on our health.
Human beings.
Exactly. So we are starting to study this, and this actually is documented in our report, our AI in Health Supply Chain report, where we actually look at all of the innovators across board. We looked at we followed about 20 main innovators that are actually working across the supply chain value chain.
But you also did say in your report that the 20 are disconnected.
Okay, so on the disconnection, I think that was referring to the McKinsey report, which was the fragmentation across the value chain. Now, that report actually previously pointed to 9 different supply chains in Nigeria in the healthcare sector. You can imagine the inefficiency that came with that. But now that we have the National Supply Chain project, National Supply Chain Integration Project, led by the Ministry of Health right now, we are seeing that being collapsed into a more efficient supply chain across the health sector in Nigeria specifically.
What about connecting the continents?
Well, connecting the continent to what context?
I mean, with the supply chain.
Yes.
So we don't, as Nigeria, we don't have to only depend on what Nigerian manufacturers.
Yes.
You understand?
Yes.
We can also look to South Africa and other African countries.
Exactly. So there's an initiative being run by the Africa CDC to champion local manufacturing across the continent. You can imagine the impact during the pandemic, where we didn't have access to immediate access to life-saving medicines and those interventions. Point in case is PVAC right now, the presidential initiative right now that is actually bringing local manufacturing into Nigeria, where Nigeria becomes a hub for WHO certified products, medicines to serve our community at lower cost, which is with the partnership with PMG, MAN, and other players to bring down cost, to ensure that accessibility is not impacted across the value chain. So a lot of, just taking it back slightly to the health tech innovations, part of our report on AI in health tech in supply chains, actually you can marry it with another report that we did on innovators, about 350 innovators in sub-Saharan Africa that are actually fixing the entire end-to-end value chain. One, they're looking at issues on our demand forecasting, our inventory management, looking at our procurement processes to try to simplify and make them more efficient. Because again, without these interventions, you're seeing increased costs, which lead to increased costs for these medicines, and then it becomes an accessibility issue. This is where counterfeits usually come in.
And Salient Advisory is saying AI has a solution to everything. The bottlenecks,
Exactly.
the disconnection.
Yes.
And these 350 innovators, are they working together?
They are working together. So
on
they
the
are
platform?
No, not on the platform. They are across. They speak to different issues.
Aspects of the supply chain.
Exactly. Specifically, our report looks at the end-to-end value chain from demand, from planning to sourcing and procurement, to manufacturing, to distribution and logistics, to
demand forecasting.
Yes. So on the demand forecasting side, the solutions we're looking at, for example, we showcase two innovators, one in Ethiopia and one in Kenya. In Kenya, In Supply Labs was actually able to cut down procurement time from about 3 days to 1 hour. Right, from integrating their systems and automating their processes. We also have another innovator that we showcased in Kenya, that was in Ethiopia, sorry, that was able to actually take about $38 million on procurement spend. Actually reduce it.
All of this is private sector drive, yeah?
Exactly.
And not with the government.
Not public sector. And that is where the next discussion goes, is how do we bridge this gap?
Exactly. Because you really need the government if you want to do the huge bridging of the gap.
So impact is usually going to be felt best in the public sector. Right, and that is where we also, in addition to the AI and supply chain report we did, we actually have a program called I3, where we bring innovators and funders to ensure that the innovators are showcased and have the funding to build their solutions. But what is happening now, what we're seeing, is that they're not building for the public sector; they're building for the private sector, and this is where we need the government to actually come in.
PVAC, yeah.
Exactly.
So I think you guys should reach out to PVAC.
No, we are working with PVAC.
So that we should be able to bring the public sector, bring them in a bit. And
exactly. We're working across board.
All right, thank you so much, Mr. Dinjeguye, Director of Supply Chain at Salient Advisory. Thank you for your time.
Thank you so much, Ini. It's my pleasure being here.